Hello everyone. Today we are going to study the remaining part of the physiological change in the normal peurperium. So in the last class we have seen after the breast changes. Today we are going to see endocrine system changes. So first one is placental hormones. Expulsion of the placenta result in dramatic disease of hormones produced by the placenta. So because of the placenta is expelled, means it came out, there is a dramatic change in the hormone. The placental enzyme insulinase causes the diabetogenic effects of pregnancy to be reserved, and it resulting in the significantly lower blood sugar level in the immediate postpartum period. Estrogen and progesterone levels decrease markedly after the expulsion of the placenta, reaching their lowest level and 1 week into the postpartum period. And the decreased estrogen level associated with the breast engorgement and diuresis of excess extracellular fluid that has accumulated during the pregnancy. So next, the estrogen level in non-lactating women being to increase by second weeks after the birth, and it can be higher by postpartum day 17. Next is pituitary hormone and ovarian function. Lactating and non-lactating women differ in the time of the first ovulation. See, lactating means the mother who is feeding their baby. The persistence of elevated serum prolactin levels in breastfeeding women appears to be responsible for suppressing the ovulation. You may heard that the breastfeeding is act as a natural contraceptive. So why? How? Because if they are feeding their baby, so it is responsible that their ovulation is suppressing because of prolactin hormone. Okay. And in women who breastfeed, prolactin levels remain elevated into the 6 weeks after birth. Serum prolactin level are influenced by the frequency of breastfeeding, the duration of each feeding, and the degree to which supplementary feeding are used. And prolactin level decline in non-lactating women and reaching the pre-pregnant range by third week of postpartum period. And about 70% of non-lactating women resume menstruation by 3 months after the birth. That's why, like, even after the birth it may take 3 to 6 months, okay, for some women even 1 year also to get the next periods. The mean time to ovulation in women breastfeeding is about 6 months, and the resumption of ovulation and the return of menses in lactating women are determined by the breastfeeding pattern. So how the woman is breastfeeding, based on that only they will get the next periods. Minimum 3 months, maximum it may be 6 or 1 year. The first menstrual flow after the childbirth is usually heavier than the normal. Means when they get their first periods after the delivery, it will be little heavier than the normal. Within 3-4 cycles, the amount of menstrual flow return to the woman pre-pregnant volume. Means the amount will be normal after 3-4 cycle of menstrual periods. Next we are going to see what are the changes occurs in the abdomen. So in the abdominal muscles, it protrudes during the first day after the birth, and during the first 2 weeks after the birth, the abdominal wall is relaxed, and it takes approximately 6 weeks to return almost to its non-pregnant state. And the skin regain most of its previous elasticity, but some striae may present. Okay, the return of the muscle tone depends on the previous tone, proper exercise, and the amount of adipose tissue. The next one is in the urinary system. The diminishing steroids level after the birth may explain the reduced renal function that occurs during the peurperium. And the urine components, that is blood urea nitrogen level, increase during the peurperium as autolysis of the involving uterus occurs, and this background of excess protein in the uterine muscle cell result in a mild proteinuria for 1 to 2 days after the childbirth. So what happens in the urethra and bladder? If trauma to the urethra and bladder occurs during the birth process, the bladder wall becomes hyperemic and edematous, often with a small area of hemorrhage. The birth-induced trauma increase the bladder capacity, and the effects of the conduction anesthesia combine to cause a decrease in the urge to void, means to pass urine. In addition to pelvis soreness, from the forces of labor, vaginal laceration or an episiotomy, which they reduce the balding reflexes and decrease the balding along with the postpartum diuresis may result in bladder distension. And distension bladder push the uterus up and to the side, and this prevents the uterus from firmly contracting, which may cause excessive bleeding. And bladder tone is usually restored 5 to 7 days after the childbirth. Next, changes in the GI system. First one is the appetite, means in hunger. The mother is usually hungry shortly after giving birth. Second one is bowel evacuation. A spontaneous bowel evacuation may be delayed until 2 to 3 days after the childbirth. Means to pass the stools, it may take 2 to 3 days even after childbirth. This cause can be explained by the decreased muscle tone of the intestine during the labor and the immediate peurperium, pre-labor diarrhea, lack of food or dehydration. Why it needs 2 to 3 days? Because the muscle contraction, okay, it delayed or it reduced, and sometimes because of lack of food, because during this pain or labor time they didn't have food, or because of dehydration. Next, changes in the cardiovascular system or cardiovascular function. Most dramatic changes occur in this system. Cardiac output decreases rapidly and returns to the normal by 2 to 3 weeks of postpartum. And hematocrit increases and increase the RBC. Leukocytosis with the increased white blood cells common during the past postpartum week. And what about the blood volume? The blood volume which increased during the pregnancy is eliminated within the first 2 weeks after the birth, and with return to the non-pregnant value by 6 weeks of postpartum period. Next, we are going to see what changes occurs in the vital signs, means in your temperature, pulse, respiration and blood pressure. First one is the temperature. The temperature is slightly elevated, 0.5 degree for the first 24 hours and up to 38 degree is known like normal only. So immediately after the birth, the temperature of the woman or mother, it will increase slightly. And this rise in temperature is due to absorption of waste products of muscular contraction of labor. And transient rise in temperature later on due to because of milk engorgement, or because of constipation, because of nervous excitation or infection. So normally if it is like 0.5 degree, in that time you can say it's normal only, and sometimes it may rise because of other these causes also. Next, in the pulse. The pulse is full and slow, about 60 to 70 beats per minute, and is also as a physiological bradycardia for 24 to 48 hours after the labor. Why there is a bradycardia? It is due to the rest period after the labor, the increase in the circulatory blood volume on account of the elimination of the placenta full, and the pulse should remain below 100 beats per minute. If all is going well, the rapid pulse may be brought on by pain, visitors, excitement, exhaustion, nursing infants, hemorrhage or infection. Next, in the respiration. This is in the usual relation with the pulse and temperature. Because of the reduction in the size of the uterus, relaxation of the abdominal wall, respiration is more abdominal in character, and deviation from the normal way suggests pneumonia or embolism. Blood pressure, no changes is counted, but if hypotension is present, postpartum hemorrhage may be suspected. Okay, like normally in the blood pressure there will be no changes, but if you notice there is a hypotension, then there is a chance of PPH, that is postpartum hemorrhage. If hypertension is present over 145/90 mmHg, there is a chance of postpartum toxemia. Okay, so in case of hypertension it is a chance of PPH, and in case of hypertension there is a chance of postpartum toxemia. Next is in the blood volume and in the fluid, what are the changes occur? Marked leukocytosis or thrombocytosis occur during and after the labor. The leukocyte count sometimes reaches 30,000 liter with the increase, and there is also a relative lymphonia and an absolute eosinophenia. Normally during the first few postpartum days, hemoglobin concentration and hematocrit fluctuate moderately. if they fall much below the level present just prior to a labor procedure. It is a considerable amount of blood has been lost. By 1 week after the delivery, the blood volume has returned nearly to its non-pregnant state. Next one is in the respiratory system. It's returned to the normal by approximately by 6 to 8 weeks of Peurperium or postpartum period, and vessel metabolic rate increase for the 7 to 14 days postpartum, secondary to mild anemia, lactation and psychological changes. Next one is neurological system. Discomfort and fatigue are very common. After pain and discomfort from the delivery and laceration, episiotomy and muscle aches are very common. Frontal and bilateral headache are common and are caused by the fluid shift in the first week of Peurperium. And the elimination of physiologic edema through the diuresis that occurs after childbirth relieves carpal tunnel syndrome by easing the compression of the median nerve. Next, in the musculoskeletal system, generalized fatigue, weakness, decreased abdominal tone, diastasis, and until healing is complete, abdominal exercise are contraindicated for the woman. Next one in the integumentary system. So chloasma of pregnancy usually disappear at the end of the pregnancy. Hyperpigmentation of the areola, nelia may be non-regress completely after the childbirth, and it may be permanent in some women. Stress mark on breast, abdomen and hip and thigh may fade but usually do not disappear. And hair growth slow during the postpartum period, and some women may actually experience the hair losses. And the immune system, no significant change occur during this period. Next one is psychological changes during postpartum period. So in that phases of maternal or emotional changes in the mother during the postpartum period, as you know, see lot of changes happen during the pregnancy. Even after the delivery also there is so many changes going to happen. So because of that reason there is a first of all emotional changes. Restorative process as the described by the Reva Robin passed through 3 phases like taking in, taking hold, letting go. Means whatever it came that they have to take in, they have to accept. Taking hold phase means okay, they will try to adjust, and letting go means whatever happened, let it go. So these are the 3 phases in psychological changes. The next point is components of care during the postpartum period. What are the care you have to give? You have to give care to the mother, you have to give immediate care to mother and baby, subsequent day leave to the mother and baby, and care of the newborn infants. What are the objectives? What is our objectives? The objectives is secure physical and mental rest, restore normal good muscle tone and maintain normal body function, provide proper adequate nutrition and guard against any infection. Next, teach the mother how to take care of herself and the baby, foster and maintain family ties and adjust the parents to their new role, and to encourage the mother for the breastfeeding. Nursing assessment. The first hours after the placenta separation and the birth is under the management of the labor ward nurse. Observation of the bleeding sign of and any symptoms by how palpating the fundus of the uterus through the abdominal wall. Normally, inspecting the perineum and perineal pad for the obvious sign of bleeding, taking and recording the vital signs every 15 minutes, and observation of leg for the sign and symptoms of DVT, deep vein thrombosis. Next, some important exercise that you are going to advise the mother: pelvic floor exercise, abdominal tightening, pelvic tittling or rocking, rectus gap, hip hitching, and foot and leg exercise. See, here are some pictures. See, these are the things we can advise the mother to do after the delivery. Stretching and strengthening exercise after the delivery, like pelvic tilt, side leg lift or crossover, wall squat, dead bug, the plank, diagonal cut, partial cut, quadrip arm or leg raises, and side leg lift. So these are the some exercise that we can advise for the postnatal mother. Next, we are going to see about the minor discomforts during the postpartum period. Okay, minor already we have studied, no, for normal newborn physiological in this during pregnancy also there are some minor disorder. So same thing during the postpartum period also there are some minor disorder. So the minor complaints are, they are minor complaints felt by the Peurperians during the postpartum period. Simple nursing measures intervention are needed to alleviate this complication. So these are the minor problem which is not needed any medication. Like with a simple medication or with the simple nursing intervention it can be cured. The first one is after pain. It is a spasmodic colicky pain in the lower abdomen during the early postpartum days due to vigorous contraction of the uterus. So because of the contraction of the uterus after the delivery, the patient or the woman can feel the spasmodic colicky pain. Okay, and it is more common and more severe in multipara due to weak muscle tone and condition with increased intra-abdominal pressure. Example, polyhydramnios, multiple pregnancy and large size infant. So what is the causes or predisposing factor for it? Presence of blood clot inside a piece of membrane or placental tissue, and breastfeeding increases after pain. Okay. So nursing management, simple uterine massages we can provide, reassurance and simple explanation of the causes and proper positioning, offering warm drink, mild sedative on doctor orders before feeding, avoid full bladder. Okay, means if they are drinking also they should not drink for a full. Encourage the abdominal muscle exercise and pelvic for muscle exercise. Next problem is urinary retention. It is the inability to excrete urine, that is urine is accumulated within the urinary bladder and common complaints during the first few days. Means the urine will be accumulated in the bladder. They are unable to void it. What is the causes? The first cause is laxity of the abdominal muscle, inability to micturate in the recumbent position, reflex inhibition due to stitched perineum or bruised urethra, atony of the bladder and compression of the urethra by edema or hematoma. Treatment for it, urine should be passed approximately 8 to 12 hours after delivery. If not, the following measures should be attempted, that is perineal care with warm water, privacy and reassurance, warm pad pen, listening to the sound of running water, hot water bottle over the symphysis pubis. If this measure fails, then only we will go for catheterization. So first we will try with the normal intervention. If it is cured, it's okay. If it is not cured, then we will go for this catheterization. The next problem is constipation. An abnormal, infrequent and difficult evacuation of PCOS may occur during the first few days postpartum. Nursing management health teaching should consider the following: diet rich in means fiber rich diet, increase fluid intake, milk before bedtime, and exercise. After 72 hours of glycerin suppository or mild laxative may be administered as ordered. So first we will try with the milk, water, fiber rich diet or exercise. Then also if it is not getting recovered, we can go for suppository. The next one is engorged breast. It is a accumulation of increased amount of blood and other body fluids as well as milk in the breast, and this condition occurs frequently about the third day of postpartum, especially in primiparas, and it is due to lymphatic and venous engorgement and is relieved when milks come out. Causes are inadequate or infrequent breastfeeding and inhibit the milk ejection reflex. How we can find out signs and symptoms? Breasts are firm, heavy, okay, swollen and tender and hot. Pain may be present leading to the irritability and the insomnia, and the mother may refuse to nurse the infant. Nursing management: apply moist warm pack to the involved breast 2 to 3 minutes before each feeding, and massage and manual expression of milk to relieve the areolar engorgement before feeding, and this facilitates the attachment. Okay, so this is the, like, you have to teach the mother how they should go for massaging the breast or stroking the breast to relieve the breast engorgement. Cold application after the feeding. A well fitting brush should be used to provide support and comfort, and the mild analgesic may be ordered if it is needed. Okay. So during this everything, after that you have can advise give the discharge to the mother. Okay, and you can advise them for come for the postnatal visit. So while giving discharge, what are the instructions we should give? First, patient and their family should be instructed to call the healthcare provider if the patient has any of the following things like fever, foul smelling of lochia, large blood clot or bleeding that saturated a pad in 1 hour. Okay, discharge or severe pain from incision, hot, red, painful area of the breast or legs, bleeding and severe pain in the nipple, severe headache or blunt vision, chest pain or dyspnea without exertion or frequent painful urination. Okay, in this case means we should inform the doctors or hospital. So with this we have completed the changes that occurs in the Peurperium, normal Peurperium, okay, in the postnatal periods. Thank you everyone.